Coping with COVID is brought to you by the South Carolina Department of Health and Environmental Control. Visit scdheck.gov for an updated list of testing sites and important information on how to protect yourself, your family, and friends from the coronavirus. SCDHEC, healthy people, healthy communities. Also, the City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Log on to columbiasc.net/OBO. Agape Counseling and Training Center. Call 803-779-2777 for licensed professionals of counselors and social workers helping families, engaged and married couples, and individuals of all ages gain an understanding of all aspects of their life. If you're having a challenge coping with COVID, contact Agape Counseling and Training Center at agapects.com. And Columbia Housing Authority. The agency is looking for stories from former residents of Allen Benedict Court to retain some of the property's rich history. In its 80-year life, Allen Benedict Court has been home to some of the country's elite, including a Grammy Award-winning performer, corporate executives, national television celebrities, a host of doctors, lawyers, and NBA greats. So share your pictures, mementos, and memories at chcares@chasc.org. Coping with COVID, brought to you by the South Carolina Department of Health and Environmental Control, the City of Columbia Office of Business Opportunities, Columbia Housing Authority, Agape Counseling and Training Center, and Palmetto Media Connection.
Coping with COVID with Tre Tailor.
Fight the spread and take a stand against coronavirus. Wear a mask in public. Stay at least 6 feet apart from others. And get tested. Join us and fight the spread. Visit scdheck.gov/COVID-19.
Hey there, I'm Tre Tailor, and you are watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. It's brought to you by SCDHEC, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Center, and Palmetto Media Connections. Listen, December 15th is almost here. Do you know what that day is? Well, it's the final day to enroll in the ACA, the Affordable Care Act, Obamacare, as a lot of people call it. And if you've got questions, Rozalynn Goodwin is here with all of your answers. She's with the South Carolina Hospital Association. Roz, thank you so much for joining us today.
Thank you, Tre, so much for having me and always keeping our communities informed.
Oh, thank you so much. It's like Christmas for you now, huh?
I guess you can say that.
It's the most wonderful time of the year for the folks in the South Carolina.
Listen, we need to remix that song.
That's right. That's right. We'll come right back with Rozalynn Goodwin next. But first, your COVID community updates. After a week of controversy, Lexington School District 5 will suspend face-to-face learning at middle and high schools. The board voted during a special meeting yesterday to go back to the hybrid schedule to help with staffing issues. In January, the school has plans to resume in-person learning. Buddy Pugh will have a 19th season at South Carolina State University. The school's winningest coach, whose contract was up this year, was given a one-year contract extension, keeping him with the Bulldog football team through 2021. And some updates on free meals in South Carolina. Lexington, too, will offer free breakfast and lunch to students ages 18 and under during the winter break. Now, curbside pickup is available to any child, regardless of where they attend school. You must make a reservation at paypam.com. That's PAYPAM.com, or the Lexington 2 website. Meanwhile, Richland 1 has a new pickup schedule. Now food will be distributed 9 a.m. until noon at St. Andrews Middle School, Eau Claire High School, Lower Richland, or Carver Line Elementary School. SCDHEC has your most up-to-date list of times, dates, and locations for COVID testing and flu shots in South Carolina. Visit scdheck.gov for more information, and you can also go to gogettested.com. Now, if you go to that website, we've got a graphic to show you. You can find out the closest location for free tests statewide, make an appointment, and get your results in 48 hours. It's gogettested.com. Check the scroll at the bottom of the screen throughout the show for information on organizing a COVID screening at your event or in your neighborhood. You can contact DHEC for that. Also, the DHEC Care Line is available. Not only will they give you information about COVID, about testing, but you can also hook up some transportation to get a COVID test. Now, speaking of transportation, if you are unable to travel to a test, Richland and Clarendon County paramedics are actually doing in-home COVID testing. Dial 911 for more information about that. Mask Up, ColumbiaSC.com is still going on. It's a cool contest launched by the City of Columbia. All you have to do is take a picture of yourself in your favorite mask, post it, share it, get some folks to like it, and you could be a winner from the City of Columbia. It's Mask Up, ColumbiaSC.com. If you're having some challenges with mortgage or rental help, the South Carolina Legal Association and SC Legal Services have collaborated on a toll-free number and a website. It's listed on the screen. So please, if you need the help, make sure you log on and get it. Speaking of help with bills, the City of Columbia is continuing to offer their 6-month payment plan for water bills. You can also get up to 75% off of your water bill with payment assistance. If you're having some challenges learning and schooling virtually, many people are, Rashonda Pratt has dedicated an entire YouTube page with tips, information, and suggestions for virtual learning and working. Check out Rashonda Pratt's YouTube page. Finally, you've got about another hour for the free DJJ drive-through job fair. It's going on today at 1721 Shivers Road in Columbia. You need to bring your driver's license, birth certificate, social security card, college transcript if you have it. Signing bonuses are available, and they'll be there until 3 o'clock today. Finally, graduating high school seniors have an opportunity to get a great scholarship. This scholarship from the South Carolina Association of Counties will award a $2,500 scholarship on an annual basis every year you're in school to a graduating high school senior in Richland County. You see the information on the screen. So if you are a graduating high school senior or know a graduating high school senior, please check out the information. Well, you're watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. Please post and share this information out so we can get the message to the masses. And as a matter of fact, you can go over to the Tailor Made production page. We're streaming live on there. That's the home of Coping with COVID. You can not only watch Coping with COVID Wednesday, Thursday, and Friday right here on Facebook Live, but you can also get all of your COVID-related updates. You can also go over to YouTube. We are streaming live on YouTube. I want to say hi to all your YouTubers and thank you so much for watching. And please do subscribe to the YouTube channel. Finally, we're on Instagram. Please like and follow us on IG. I'm Tre Tailor, and 'tis the season to register for the Affordable Care Act, ACA, Obamacare, whatever you call it. It's time for you to register. December 15th is the final day to enroll, and Rozalynn Goodwin with the South Carolina Hospital Association is here to help us get on board. Thank you again, Roz, for joining us today.
Delighted to be here. Always a pleasure to talk with you during open enrollment season.
Yes. So I've got it right? So open enrollment is until December 15th. Is that correct?
Open enrollment for the Affordable Care Act is until December 15th. We'll be talking about all types of open enrollment today, including Medicare open enrollment. Okay. That deadline is actually fast approaching. That is December the 7th. So you just have a few more days to select supplemental plans for Medicare. So we all know when you turn 65, you are automatically eligible for Medicare. Mm-hmm. A lot of people don't know that you have to enroll in Medicare.
Oh, really? Okay. So you don't just get it automatically, right?
You don't get it automatically. You have to enroll. We actually went through this with a family member about 2 years ago. They ended up in the hospital and they assumed that since they were 65, they had Medicare, but they were in the hospital with no health insurance because they did not actively enroll in Medicare. So this is a little different. The open enrollment period for Medicare is more so about you selecting supplemental plans, the plans that will cover your prescription drugs, because we know a number of vulnerable seniors who have Medicare, but their prescription drug costs are astronomical, and they end up skipping taking medication because they cannot afford to pay for that medicine. So for you to get a supplemental plan to cover prescription drugs or anything else outside of a hospital stay or a doctor's visit, you have until December 7th to pick out those plans. And there's assistance available. Some of them are very affordable, almost no money coming out of your pocket. And we'll be saying this number all this broadcast. You can put it down, write down your notes, text it to people. It is 888-998-4646. We've set up a toll-free hotline that is statewide that you can speak with someone and get local free help. Someone right here in South Carolina who understands the hospitals that you prefer, the doctors you prefer, the different coverages that are in the network with all the different plans that are available. They can help you with Medicare. They can help you with the Affordable Care Act. They can help you with Medicaid. They can even help talk you through your employer's health insurance options. So again, 888-998-4646. Our great friends at Palmetto Project can help you with any type of healthcare question or decision. They can enroll you in these Medicare supplemental plans over the phone. They can enroll you in the Affordable Care Act over the phone. They can do all of this over the phone. So that number again, toll free, 888-998-4646.
All right, 888-998-4646 if you have any questions or need some assistance with signing up. Now, you say the Medicare deadline is December 7th. And that is so interesting. So once you turn 65, you're eligible, but you have to apply.
You do. You have to enroll. You're eligible. So you're not technically applying because you qualify for it just by turning 65. It is an entitlement that's part of our rights. As U.S. citizens, you've been paying for it all your life. Right. So at 65, you can access it, but you still have to actively enroll. And most people will get almost all you're supposed to start getting mail a few months before your 65th birthday. Mm-hmm. And what happened in the case with our family, they saw the mail, but they didn't open the mail. They just assumed that, it was just telling them that they were going to be covered.
Wow. Yeah.
And, it's, most people don't realize that you actively have to enroll in the Medicare program. You can do that, of course, when you turn 65, or right before you turn 65. So you've got a window around your 65th birthday to get enrolled.
All right.
Like I said, that is separate from December the 7th.
Right.
Your enrollment in Medicare is based more so around your birthday. But enrolling in a supplemental plan to help you with any cost outside of a hospitalization or a doctor's visit, you have till December 7th to do that.
Okay, so when you turn 65, and you should do it, like you said, around your birthday. How do you apply for Medicaid?
So you will get actually a card in the mail. Okay. You can do it over the phone. You can send it by mail with the Social Security office. You can, show up there. Of course, right now we're trying to stay as safe as possible, but you can sign up for Medicare. You can actually call the toll-free number that I provided for you before, and they can walk you through the process.
Okay.
Any time of the year around your 65th birthday. But it is pretty simple. The forms can be mailed in. You can call in and get signed up, and then your Medicare card will be mailed to you to your home address.
All right. We're talking to Rozalynn Goodwin, Vice President of Engagement for the South Carolina Hospital Association, about insurance, health insurance. And she was just telling us about Medicare. So you're saying now that the December 7th deadline, Roz, is to get health insurance coverage on top of what you have for Medicare. How much do you need, and how do you know what you need?
And that's why we really encourage you to reach out to our local experts. When you dial 888-998-4646, you'll be talking to a broker who has been trained and certified to walk customers through their various options. It really depends on a number of your health factors and conditions. If you are 65 but not on any type of medication, you may not need a very heavy prescription drug supplemental plan. But if you've got a number of pre-existing conditions, and if you're on a daily regimen of different medications, you'll need some supplemental prescription drug coverage because those costs out of pocket are cost prohibitive. And like I said, there are a number of seniors who go without that, but they don't realize that there are options available to cover their prescription drugs. There are a number of seniors who qualify not only for Medicare, but Medicaid. They're called dual eligibles. Mm-hmm. And many of them can get these costs completely covered. So if you have a senior in your life and I really encourage you, take this number down for them, maybe even reach out on their behalf and say, my mom, my grandmother has Medicare, but I don't know whether she has all the coverage she needs,
Right.
prescription drugs or anything that is outside of a hospitalization or a doctor's medical visit. So I would call, and I do that before December 7th, which is the deadline for supplemental Medicare plans, and just make sure that your loved one has all the coverage that is due them, and that they're not paying unnecessary costs out of their pocket. Because there are a lot of seniors who are paying for drugs or prescription drugs, and they don't have to be.
They don't have to be. Wow. Rozalynn Goodwin joins us. She's with the South Carolina Hospital Association. So, Roz, for those who don't know, because I get it mixed up too, Medicare, Medicaid, what's the difference?
So Medicare is available to you. You've been paying into our federal government and system. It is available to you when you turn 65. It is an age-based health insurance program that is totally run by the federal government. Okay. Medicaid, on the other side, is a joint program run by the federal government and our state government. Our state determines who is eligible in South Carolina. And the feds, of course, provide matching funds. But Medicaid is available for people of various ages. It is more so a category-based health insurance. So, I tell people, particularly in South Carolina, if you're not a child, in order to qualify for Medicaid as an adult in South Carolina, you have to be PO, and not poor, but PO, like you can't afford the O and the R. All right. So we're not very generous in our eligibility in South Carolina on who qualifies as an adult for the Medicaid program. Mm-hmm. We are generous, though, for children. So you can be a child and qualify for Medicaid. You can be pregnant and based on your income. And it's based, like I said, it's categories. And for each category, there's an income threshold. So if you're pregnant and you make a certain amount of money, you qualify for Medicaid while you're pregnant. But, as soon as you have the baby, you don't. If you're a child and your parents have a certain income, you qualify for Medicaid and you stay on Medicaid through your 18th birthday. But then after that, you don't.
Right.
If you're in the nursing home, Medicaid actually is what covers the bulk of nursing home costs in South Carolina. And most people don't realize that. They assume it's Medicare because it's for those who are 65 and older. But Medicaid covers the bulk of nursing home costs in South Carolina. So you can be a baby or you can be someone in a nursing home, a senior in a nursing home, and still be on the Medicaid program. It's based on those categories and how much money you make. I was just sharing on another interview just before I got on this one that I was speaking to a teacher about 2 years ago, single mom, 3 children. She was covering herself and her 3 children on her health insurance provided at her school. Now, we know our teachers are not paid enough, and Lord knows we all better know they're not paid enough right now.
Right, exactly.
Virtual school days, okay? So I was talking with her and I said, wow. And she was talking about how much she pays for health insurance. I said, let's look at the numbers. Your children may qualify for Medicaid. And we looked at the numbers and they did.
Oh my goodness.
Her insurance with her job at the school, but shifted her children to the Medicaid program, and their health insurance was completely covered. She saved hundreds.
That's amazing to know.
Because of that. So, even if you feel, well, I don't qualify for Medicaid, call the number. You may be surprised. Your children may qualify for Medicaid based on your income because we cover them a lot more generously here in South Carolina.
Yeah, that's so fascinating because I think, because I thought this, and I don't think I'm, by myself, that the Medicaid for children were just for kids who may be under DSS, foster kids, welfare. I mean, you know what I'm saying? But if you're saying it's not, your parent, you and your husband or your family could be working, and then your children could still get Medicaid, which is free, correct? There are no premiums. Medicare and Medicaid, you don't pay into it. I mean, per se, you don't have a premium.
Correct. There may be some out-of-pocket costs when you go for a doctor's visit, but particularly our Medicaid program for children, there aren't even those. So depending on your income, like I said, we cover children more generously. If anybody's listening and they're familiar with the federal poverty level, we cover children way past 200% of the federal poverty level. So, that's outside of poverty. That's above poverty. So there are a number of children who qualify for the Medicaid program. And this is why this open enrollment period is so important. And it's for you to call and talk with someone, because you can literally answer a few questions over the phone and they can tell you, well, you qualify for the Affordable Care Act, your children qualify for Medicaid, and your mother qualifies for this drug discount plan.
Right.
For Medicare. And our friends at Palmetto Project at 888-998-4646 can help you with all of those decisions and let you know what you're eligible for right over the phone. So it costs you nothing to call them just to see what you're for.
That is so good. 888-998-4646, as Raj just said. And this is a wealth of information. Just give them a call. It's absolutely free. They can get you or answer all of your questions and get you set up right from the comfort of your own home. And that's great, especially now since, people are skeptical oftentimes about going out. Now, can they also on this line, Roz, walk you through? I know we hadn't started talking about ACA yet, but can they walk you through the plans and what maybe you should and should not take advantage of?
Absolutely. They can walk you through the plans and sign you up right over the phone.
Oh, wow. Yeah, that's good. Rozalynn Goodwin joins us. She's with the South Carolina Hospital Association, and we're talking about open enrollment, as she said, for Medicaid or Medicare. For Medicare, it is next Monday, the 7th. And as she said, don't assume that just because you're 65 that you automatically get it. You're eligible, but you have to call and apply, or not apply, enroll. You've got to enroll. The other tidbit that she just shared, which is so big, I think, check and see if your children are eligible for Medicaid, because they could be based on your income. You may not be, but you could save hundreds of money, hundreds of dollars in the course of a year, not having to pay for their health insurance. So check it out. Give these folks at a call at 1-888. I can't see the number because 888-998-4646. Sign up sc.org. Rozalynn Goodwin is joining us. She's with the South Carolina Hospital Association. We were talking about Medicare, Medicaid. Now let's go to the ACA, Roz, the Affordable Care Act. Who can get the ACA? Who's eligible for the ACA?
The ACA, the Affordable Care Act, Obamacare's, whatever you want to call it, was designed for people who don't qualify for Medicare, don't qualify for Medicaid, and don't have health insurance through their jobs.
Gotcha.
It's for those people who did not have health insurance available other ways. Okay, so that's the way it was designed. And it was designed to really cover everyone. Now, South Carolina is one of 13, a shrinking minority of states who've not expanded the Medicaid program under the Affordable Care Act. So we still have a coverage gap of people who don't qualify for anything. But the Affordable Care Act really was designed to pick up anybody, if they weren't qualified for Medicaid, just to offer coverage. So that, it's still working on it. It is unfortunate that we've got about 200,000 people in South Carolina who don't qualify for anything because we haven't expanded the Medicaid program under the Affordable Care Act. But that's what the Affordable Care Act was created for. If you don't have health insurance through any of these other means that we've already been talking about, it is for you. It is for that young lady who works 2 part-time jobs and neither one of them offers her health insurance. Yeah. It's for, that person who works 1 part-time job, but they're not offered health insurance at their job. You need to make a minimum of right under $13,000 a year, about $12,700. Let me back up on that. You need to be able to predict that you will make about $12,700 a year.
Or at least, or not
one. At least that or more.
That.
Okay, so that's the threshold. And even if you're unemployed right now, but you anticipate that by the end of 2021, you will have made $12,700 through odds and ends jobs or whatever, you can still qualify and sign up for health insurance right now.
Okay.
So it is not based on how much you're making right now or how much you even made last year. It's based on how much you assume and predict that you will make, with some level of assurance, because if you get a tax credit and then you didn't make any money, you may owe some of that back.
You may owe it back, yeah. Or if you make more, right?
Right.
Yeah. All right. So folks have got until the 15th to do this. So can you enroll if this is your first time?
Oh, absolutely.
Okay.
We've got people enrolling for the first time every single year. It is the same simple process. And I want to encourage people who have been enrolled before. You need to renew or reevaluate your plan. Now, you can automatically be re-enrolled in the same plan. We don't encourage that because the plans change every year. You may be eligible for a better plan.
Gotcha.
You may be eligible for a larger tax credit. But if you don't update your information, the system is assuming that you're making the same and assessing the same type of tax credit. We've seen a number of people's income has fluctuated.
Yeah. Oh, yes.
So if you've lost hours or if you've lost jobs, just because you had a plan last year doesn't mean that that's still the best plan for you. You may be eligible for more of a tax credit. On average, close to right under $600 a month of tax credits were issued to people in South Carolina who signed up for the Affordable Care Act. So maybe you had a tax credit of $300 last year, but because of your hours changing, you may qualify for a $400 tax credit a month this year. So we want you to update your information. We want you to talk with someone. It's absolutely free. I had this plan last year, but is it still the best plan for me? Let me look at my other options, because there may be one better for you that saves you money and even extends your coverage.
And you won't get automatically renewed. Is that correct, Roz?
No, you will for a number of plans. And we've got 4 carriers now. So it's not just Blue Cross. We've got other carriers in the market. So I know that Blue Cross has a lot of automatic re-enrollments, which is not a bad thing. We just encourage everyone to reevaluate the plan that they had. So we're all for automatic re-enrollment. And that's a great safety net and a safeguard for people who may forget that I need to enroll again. But I'm encouraging everyone who's here and listening or has people and knows people who have enrolled before to reevaluate it, because you may be eligible for a better plan this year.
Yeah. I want to talk about what is new this year as far as plans, forms, prices. What can we expect, to see new and different in the ACA?
So you will see the same type of premiums. Premiums really did not increase at all in South Carolina. You'll still see the same level of tax credits. Like I said, over $570 a month in tax credits that 9 out of 10 South Carolinians were eligible for last year. You'll see that same thing available. There are a few more carriers in the state. Blue Cross Blue Shield is still the only carrier that has plans that are all across the state of South Carolina. There's some other carriers that have plans just in specific pockets of the state. So they may be in the upstate, or they may be in the low country, or they may be in the PD. But like I said, our agents who are trained in Medicare, Medicaid, and the ACA can help let you know. Once you let them know where you live, they can say, okay, well, these are the plans that are available. This carrier offers plans in Richland County. This carrier offers plans in Florence. And let you know what those various options are. So many different plans. I mean, there are hundreds of plans available. Each carrier has over 50.
Right.
So there are a lot of different plans based on how much you want to pay for your deductible, how much you want to pay out of your pocket. If you want to have an HSA, all of those different plans are available in the marketplace.
Okay, we're talking to Rozalynn Goodwin with the South Carolina Hospital Association. When we come back, she will rejoin us to tell us how to get ready to enroll in the ACA, finding out about kids with plans on parents, the free help to assist. How do you decide what to get? Zero payment plans, all that and more coming up next with Rozalynn Goodwin from the South Carolina Hospital Association as we talk ACA enrollment on coping with COVID. I'm Tre Tailor. We'll be right.
Coping with COVID is brought to you by the South Carolina Department of Health and Environmental Control. Visit scdhec.gov for an updated list of testing sites and important information on how to protect yourself, your family, and friends from the coronavirus. SCDHEC, healthy people, healthy communities. Also, the City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Log on to columbiasc.net/OBO. Agape Counseling and Training Center. Call 803-779-2777 for licensed professionals of counselors and social workers helping families, engaged and married couples, and individuals of all ages gain an understanding of all aspects of their life. If you're having a challenge coping with COVID, contact Agape Counseling and Training Center at agapects.com. And Columbia Housing Authority. The agency is looking for stories from former residents of Allen Benedict Court to retain some of the property's rich history. In its 80-year life, Allen Benedict Court has been home to some of the country's elite, including a Grammy Award-winning performer, corporate executives, national television celebrities, a host of doctors, lawyers, and NBA greats. So share your pictures, mementos, and memories at chcares@chasc.org. Coping with COVID, brought to you by the South Carolina Department of Health and Environmental Control, the City of Columbia Office of Business Opportunities, Columbia Housing Authority, Agape Counseling and Training Center, and Palmetto Media Connection.
Coping with COVID with Tre Tailor.
Palmetto Media Connections, connecting media and communities together. Established in 2010 with past national media guests like Janice Huff, Mitch Faulkner, and Dolores Washington, and local celebs like Cynthia Hardy, Miranda Parnell, Vaughn Gaskin, Kevin Cohen, Vanzell Hare, and Makita Pearson, and hosted by Darcy Strickland and Tony G. Palmetto Media Connections in the past has distributed to the community over $1,000 in gift cards. Connect with us on Facebook and subscribe to our YouTube channel, Palmetto Media Connections, connecting media and communities together.
People will be able to look 100 years from now. They will know how we got over. This makes it even more important that we shine this light.
Part of it also wasn't the fact that we couldn't have the physical graduation, but I also couldn't celebrate with my family out of town.
For me, I feel like this is a new normal. This is not going away anytime soon, I don't think.
Anything that's happened before can happen again. And the same thing is at play with this virus.
You know, we are no longer in a building, and we've talked about church being, with us, in us.
Have you traveled abroad late in the past 6 months? We were trying to trace it back as early as November.
This flu season arrives during the COVID-19 pandemic. Groups at risk for serious illness from COVID-19 and flu are similar, but complications from flu are much higher in young children. Everyone over 6 months of age should get a flu shot to help prevent more illnesses, hospitalizations, and deaths in South Carolina.
The flu is not just a cold. Each year, many South Carolinians are hospitalized from the flu and even die.
Getting the flu vaccine is the best protection against the flu for everyone in your family.
The flu vaccine is safe, effective, and does not cause the flu.
You can make a difference this flu season by protecting yourself from the flu.
It's important that I protect my baby.
It's important that we protect our families.
It's important that we protect our schools.
And our students.
It's important.
It's important.
It's important.
It's important that we protect our state.
Talk to your healthcare provider, pharmacist, or health department about the flu vaccine today.
Hey there, you're watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. It's brought to you by SCDHEC, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Center. Listen, if you are having some challenges coping with COVID, please contact the folks at Agape Counseling and Training Center. Coping with COVID is also brought to you by Palmetto Media Connections. I'm Tre Tailor. When I invite you to post and share this information out because this is such good knowledge about the ACA, the Affordable Care Act. Thank you for everyone who who is watching. We're going to be rejoined right now by Rozalynn Goodwin. She is with the South Carolina Hospital Association. And as Roz gave us some great nuggets last segment, if you get a chance to go back and watch the replay, please do. She gave us great information about Medicare. You are eligible if you're 65, but you don't just automatically get it. You've got to you've got to call or text or send a smoke signal or tell those folks, I'm here and I want, give us free. Give me what I'm entitled to. And the other thing that you said, Roz, that I thought was so good that as you said, people don't know. You can get Medicaid for your kids. You don't have to pay those high premiums for your kids. Call and find out if your children qualify for Medicaid. And this is the information that Roz gave us. Sign up sc.org and 888-998-4646. Give them a call and you can find out about Medicare, Medicaid, and about the ACA, the Affordable Care Act. So Roz, the deadline, as you say, for applying for Medicare or upgrading your Medicare, getting whatever else you need, because again, something else you mentioned is you can't assume that you're going to get the coverage that you need with Medicare. You can talk with those folks and find out if you need more. That's December 7th. December 15th is the deadline to enroll in the ACA, correct?
Correct. You got it, Trey.
I got a great teacher in you. So you call these folks. What kind of documents do you need to gather, whether you're enrolling or re-enrolling?
So you will need your Social Security number and all the Social Security numbers of the people in your home that you're planning to enroll. So if you are calling about coverage, not only for yourself, but your children, make sure you have all of those handy. It would help if you had pay stubs or at least a good estimate, a really good estimate of the income you have made over the last year, just so they can help you determine what your income projection would be for 2021. Again, your eligibility for the Affordable Care Act is not based on what you made last year. It is based on what you predict you will make next year, 2021. But having those pay stubs handy from the past year or this year, 2020, will help you figure out, okay, what is the income that I can, as close to accurately as possible, assume that I will make in 2021 to make sure that the tax credit I receive is as accurate as possible, so I don't owe money back from taking advantage of the tax credits with the Affordable Care Act.
Now that tax credit, that's the subsidy you receive, so you don't have to pay all the insurance premium, correct?
Right. So you'll sign up for a plan with the Affordable Care Act, and the premium may be, $600, $700 a month, depending on how many people are on your plan. But you may also receive, on average last year, the subsidies that over 200,000 people in South Carolina enrolled in the Affordable Care Act this past year. Their subsidy was close to $600 a month. That was on average.
Wow.
So there are many South Carolinians, 9 out of 10, on heavily subsidized plans. That just means that that premium doesn't come out of your pocket. It is funded through the Affordable Care Act.
Right. And so that means that maybe you could get a zero down or a zero premium based on what you enroll in, correct?
That is right. We're going on this is the third year that zero premium plans have been available in South Carolina. So the subsidy, the tax credit, is so generous that it zeroes out your premium, the part that you would be paying each month. And that is on a bronze level plan. Of course, there are different levels of health insurance plans.
Right.
And we talked about this based on how much of a deductible do you want to pay? Do you want 80% of the coverage covered by the health insurance and you cover 20? Do you want 70% of the coverage paid by the insurance company and you cover 30? Those persons are good friends at Palmetto Project on the other end of 888-998-4646 will help walk you through that. What do I choose? Do I choose a plan that they cover 80%, I cover 20. They'll talk to you about your income, what type of disposable income do you have to pay for a premium. And in a lot of cases, it may be that I need health insurance. I don't anticipate that I will have a whole lot of healthcare needs. I just want to make sure I have basic health insurance, that in case something happens, I'm covered. I don't have to go into financial bankruptcy. Medical bankruptcy is the number one cause of bankruptcy in America.
Wow.
So having some type of health insurance, so you may not need something that is as generous as a 90% to 10%. You may be fine with a 70% or 30%, and you pay a higher deductible in case something happens. And in those cases, you can get a zero premium plan. So you're not struggling to make those premium payments each month, but you have health insurance just in case something happens.
Yeah. This is Rozalynn Goodwin with the South Carolina Hospital Association. She's open to answer your ACA enrollment questions. Go ahead and continue to post and share this out. Let's talk about those plans. You said there are different levels of plans. Let's talk about the 3 levels and what each entails.
So the bronze level plan is just your basic type of healthcare insurance. The carrier or the insurance pays 70%, you pay 30%. You go up to the next level is silver, 80-20. That is one that, if you've been in the work environment, that's usually kind of what is offered there.
Right.
The insurance company pays 80, you pay 20. There's also a gold level plan where the insurance company pays 90 and you pay 10. And those are just basic examples. There are so many different types of plans that are out there. And those are just kind of the metallic level of how the plans are broken down. But like I said, you can have a health savings account tied to a plan. It really just kind of, you look at it and figure, how much health care do I think I anticipate needing? Will I just need my well visits?
Right.
Or will I need monthly checkups because I have a pre-existing conditions or I have a diagnosis that really requires me to see my doctor more often than once every 6 months or once a year. And our good friends, again, at Palmetto Project can help walk you through that and ask you those critical questions about, how much did you go to the doctor last year? How much do you think you'll be going to the doctor in 2021? And let's put you in a plan that is not only good for your wallet, but also good for the healthcare needs that you anticipate having, not only for you, but also for your family.
Yeah, I tell you, every year I typically sign up for myself. I don't get any help. I am going to get some help this year because a mistake I made last year was, and I usually get dental, and I want to ask about that too.
Oh, yeah.
And so I got a dental plan that I had gotten before, but this year my dentist, it didn't cover the things I needed. It didn't give me enough cleanings. It didn't give me the deep cleanings that I need, because I've worn braces. And so I kind of went a lot of I had enrolled, paid it up front, and then recognized this isn't, I can't use this.
Right.
And I wish I had known going in. And I guess I just assumed because I had a comparable plan and it was okay with my dentist before, that this one was okay too. And those are things you don't know if this is not your area of expertise.
Absolutely. And that's why we really do encourage you to call 888-998-4646. They can help you ask yourself those critical questions about, okay, what do I anticipate needing being done? I mean, we're talking about dental. I'm thinking about a procedure I know I need to have done. I probably won't be able to get done before the end of the year, but I know I need to get it done beginning of next year. So I need to make sure my plan is going to cover that.
Exactly.
There's no need in signing up for a plan that doesn't cover what I already know that I'm going to need in 2021. Talking to some brokers and provide some insider information. So we got to keep this. Well, we can't keep it to ourselves. I will just share some inside broker information. I'm not a broker. I will disclaim that. But my friends who are really, when they're asked about dental, and when you call this number and you're asking about dental, they may be directing you to plans that are off the marketplace. off of the Affordable Care Act marketplace, because some of those dental plans are better at this point. So the Affordable Care Act, of course, was created to provide health insurance.
Yeah.
The dental plans on the marketplace still need some work.
Yeah.
So there are a number of dental plans that they can help guide you to. Again, that toll-free number, 888-998-4646. So they can talk to you and say, okay, let's get you a health insurance plan that's on the Affordable Care Act marketplace. But if you need dental, let's look at something that's off the marketplace, because that'll be better for you. They can literally help you with all of that.
Now, if you do go off of the marketplace, Roz, obviously you don't get the subsidy, you don't get the help, right?
Right. But the plan that they will help direct you to can be very affordable, and then cover what you need. Because what's the point of having a subsidized plan that doesn't cover what you need?
Right, exactly. Like I said, I'm living proof of it. So is it fair to say most dental plans don't cost as much as the healthcare plan?
Oh, absolutely.
Yeah.
Absolutely.
So it would be much more affordable.
Right. And if you can recall, if you've worked for an organization, you see when you look at your plans, which all of us are now in open enrollment period, whether we're with Medicare, Medicaid, or even with our employer. We were just looking at our healthcare options with the Hospital Association the other day. Dental is always much less expensive to cover you and your family. So yes, dental is a less expensive insurance to have. And our good friends at Palmetto Project can help walk you through plans on the marketplace and off the marketplace to make sure that it's affordable for you. 888-998-4646.
All right. You see the number right there, 888-998-4646. Also sign up sc.org. Do you suggest the phone number or the website? Do you have a personal preference, or are both equally as effective?
I suggest the phone number, because you're going to talk to someone in South Carolina over the phone directly. If you go to the website, you have to probably schedule a call, but you can directly call and speak with someone right here in South Carolina for absolutely no cost to you, who understands South Carolina's plans, hospitals, providers, doctors, and that friendly voice will be right there for you at 888-998-4646.
How easy is it to get someone on the line, Roz, right now?
It's very easy right now, but if you wait until the 14th and
the 14th or the 15th,
which a lot of people do, December 15th at 11:52 p.m. Don't do that. Call right now. Well, don't leave this live right now.
You can call.
You got two devices up. You on the laptop, you can call on the phone. You do that right now. Okay. But you need to call now, before the influx of people who are panicking, who wait till the last minute and procrastinate. So I would not wait until December 15th. I would not wait until December 7th, because there would be a lot of people trying to figure out those Medicare supplemental plans.
That's Monday. Mm-hmm.
Yes. So today is a perfect day to call that number and get that process started. If you got the documentation and the numbers and your Social Security numbers, I've literally seen our friends, these agents and brokers, sign people up in 15, 20 minutes. Mm-hmm. It is not a long call, and they can help walk you through the options very quickly.
That's good. 888-998-4646. Call them before the 7th for Medicare, Medicaid, or December 15th for the Affordable Care Act. And as Roz said, they are folks that live right here in South Carolina that can help you, walk you through, talk about the different options that'll be best for you as far as enrolling. Like I said, I've done it myself in previous years, and it made my head explode. You know what I'm saying? It did, Roz. I mean, it was a couple of day process. I would look, and then I'd go, then I'd look, and then I go, because it's daunting.
It is, and it doesn't have to be.
Right.
Free help is available.
Free help is available.
Don't put yourself through that. Yeah. You're doing too much.
Girl, I would.
Reach out to free help.
I was absolutely doing too much. And so learn from me. 888-998-4646, 888-998-4646. Roz, anything else we need to know as we wrap up our conversation about enrollment, open enrollment?
I can't think of anything. I do want to encourage everyone to call that number. And the wonderful thing about our friends on the other end of this number is that they are here all year long. So they can help you if something comes up with
that is
your
good.
plan. And, for some reason you're getting some notice in the mail that your tax credit or, something's going on, they can help guide you through that as well. They've been very instrumental in helping people who qualified for special enrollment because of the pandemic. So many people didn't know, but because of our state being under, an emergency declaration, the Affordable Care Act essentially opened back up for people who could qualify.
Oh, right. Because their situation changed.
Because of the pandemic. Now we were under an administration that wasn't very forthcoming with letting us know that. But
that's a very nice way to put it.
Helping people get signed up even before open enrollment started.
Right.
So any change in income, and really you may be listening to this now and say, well, I'm good. I've got health insurance. I've got health insurance from my job, or I'm good. I want you to think about those persons who maybe lost hours or lost their job during this pandemic. We're in a very volatile labor market right now. But there are people who have lost jobs and they're picking up odds and ends jobs, and now they have a part-time job instead of a full-time job. And they may not be telling you that, when I lost my job, I lost my health insurance. That's thousands of people across South Carolina.
Yeah.
And I guarantee you, it's someone who's in your sphere of influence. It's someone in your family. It's your neighbor. It's somebody. I want you to take down this number and help us spread the word. We've got over 100,000 people in South Carolina who qualify for something, and they are not enrolled because they don't know. Right. And the only way we can help them in a time where health insurance, I believe, is more critical than ever. We're in a public pandemic.
Yeah.
You need health insurance. Yeah. You need access to health care to stay well.
Exactly.
And to, even if you are not well, to get better.
Yeah.
You need health insurance right now more than ever before. And there are people who qualify for free health insurance. They just don't know it. So anything you can do by clicking the share button and just sharing this on your page, taking down this number, 888-998-4646, and just asking, do you have health insurance? You got any questions about health insurance? Mm-hmm. Here's a free number. You can talk with somebody and they can help you, through your options. Are you paying too much for health insurance? Have you ever been curious that maybe your children qualify for Medicaid? These persons on the other end of this line can help walk you through that and get you signed up over the phone. So I really encourage everyone to, not just be settled and satisfied with saying, okay, I'm good. My family's good. I'm covered. I promise you there's someone around you who is not covered and doesn't have the financial security or the peace of mind in a public health pandemic because they don't have access to health care because they don't have access to health insurance. It's very critical all the time, but especially right now.
Yeah. And, and you made a good point, Roz. But the other thing is, you don't know when your situation is going to change. You say you may know somebody, you may be that somebody. And I think 2020 has taught us a lot of things, but it certainly has made us more aware of the health disparities among Black and Brown people. Minority community is disproportionately affected by everything because of our health. We've got every pre-existing condition.
Right.
So when anything comes, whether it's the cold, the cough, or flu, COVID, we're going to get hit harder.
Absolutely. And those well visits, those screenings, making sure that if you have diabetes, that you are regularly seeing your physician, staying on medication, can really be a matter of life or death if you are exposed to COVID.
Yes.
And we've seen this time and time again.
Yes. Yeah.
So your wellness is such a major part of you surviving and coping with COVID.
Yeah. Yeah. And it's here and it's going to be here. Even, with talks of the vaccine. I mean, again, I read, saw an article from Dr. Fauci. It won't be readily available to the masses till the spring or summer.
Right. We've got several months before it's available to everyone.
Right. So we still have several months of wearing our masks, washing our hands, being exposed to possibly catching it. So go ahead and get your health insurance and get yourself together. And I talked to Carmen Julius with a pals yesterday about us being more conscientious about what do you want your quality of life to be? Do you, even if you're not doing it for yourself, do it for your family, for your friends, for your loved ones, for your grandchildren, for your children. What do you want the rest of your life to look like? Do you want it to be enjoyable? Do you want to have a good time with your family and friends? The decisions you make now will definitely affect all of those things later. So
absolutely. And, there are a number of plans that are even available that incentivize you to be well, whether it's having those checkups, exercising, actually putting money back in your pocket.
Wow.
Because this is about wellness. This is about being well, staying well. And even if, God forbid, you are exposed during this pandemic, being able to overcome that because you've been well and you are well. So health insurance, of course, prevents you from having catastrophic loss, medical bankruptcy, but it also promotes wellness and incentivizes wellness, and you having those checkups and catching those things when they're early and not at stage 4 and, not at these stages where it's hard to come back from. Catching diabetes when it's pre-diabetes.
Yes.
Monitoring your blood pressure, getting it under control before you have a stroke. Like this is what we've got to do as community. We got to get on top of. We got to get
in front of it. That's right.
Because we know more now than ever before that we are disproportionately impacted and devastated. Our communities are by pandemics like this. So this is part of wellness. This is part of your wellness plan to have health insurance that allows you to have those checkups, to catch things early, and to make sure that you're leading a healthy lifestyle to have a healthy life.
Yeah. So call 888-998-4646. Free help is available, 888-998-4646, and find out about how to enroll in the Affordable Care Act, Obamacare, if you will, Medicaid and Medicare. Rozalynn Goodwin with the South Carolina Hospital Association. Thank you again so much for joining us today. You've been a wealth of information. I appreciate you. Beautiful.
Thank you always for keeping our community informed and for using your platform to do that. That means so much. We can't count how many lives have been saved by you just helping us spread the word. So thank you, Tre.
Thank you so much. That's Rozalynn Goodwin with the South Carolina Hospital Association. I'm Tre Tailor, and listen, if you have a story that could help someone cope with COVID, please go to the Tailor Made Production page on Facebook and inbox me. I would love to highlight your story or initiative. If you have a product or service that could help someone cope with COVID, please email copingwithtreitailor@gmail.com. And we'd love to talk to you about being a proud sponsor, just like SCDHEC, In It Together, the Diabetes Advisory Council of South Carolina, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Center, and Palmetto Media Connections. Now, tomorrow is Faith Friday. We are going to talk to award-winning singer, songwriter, minister, John Lakin. He is going to join us tomorrow. He's going to sing a little bit for us. That's tomorrow. And then next week, if you're a small or minority business owner, Shanice Cleckley joins us to discuss how Google is helping small business. That's next week on Coping with COVID. I'm Tre Tailor. As usual, I leave you with our reading from Jesus Calling. Today is December 3rd, and it says, "Do not be surprised by the fiery attacks on your mind. When you struggle to find me and not live in my peace, Don't let discouragement set in. You are engaged in a massive warfare. Spiritually speaking, the evil one abhors your closeness to me, and his demonic underlings are determined to destroy our intimacy. This is Jesus calling. My name, properly used, has unlimited power to bless and protect. At the end of time, every knee will bow when my name is proclaimed. People who have used Jesus as a shoddy swear word will fall down in terror on that awesome day. But all who have drawn near to me, Jesus says, through trusting, uttering my name, will be filled with inexpressible and glorious joy. This is your great hope as you await my return. That's your Jesus calling for today, Thursday, December 3rd. I'm Tre Tailor. Until the next time, I wish you peace and abundant blessings. Please continue to be careful, be safe, and wear your mask over your nose and under your chin. I'll see you tomorrow.
Coping with COVID is brought to you by the South Carolina Department of Health and Environmental Control. Visit scdheck.gov for an updated list of testing sites and important information on how to protect yourself, your family, and friends from the coronavirus. SCDHEC, healthy people, healthy communities. Also, the City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Log on to columbiasc.net/OBO. Agape Counseling and Training Center. Call 803-779-2777 for licensed professionals of counselors and social workers helping families, engaged and married couples, and individuals of all ages gain an understanding of all aspects of their life. If you're having a challenge coping with COVID, contact Agape Counseling and Training Center at agapects.com. And Columbia Housing Authority. The agency is looking for stories from former residents of Allen Benedict Court to retain some of the property's rich history. In its 80-year life, Allen Benedict Court has been home to some of the country's elite, including a Grammy Award-winning performer, corporate executives, national television celebrities, a host of doctors, lawyers, and NBA greats. So share your pictures, mementos, and memories at chcares@chasc.org. Coping with COVID, brought to you by the South Carolina Department of Health and Environmental Control, the City of Columbia Office of Business Opportunities, Columbia Housing Authority, Agape Counseling and Training Center, and Palmetto Media Connection.
Coping with COVID with Tre Tailor.